Welcome back. Toya Hopper is a nurse practitioner with Shannon Medical Center, and you are in the Shannon Weight Loss Center. Nice to have you here.
Yes, thank you. Thanks for having me.
Let's talk about kind of what the newest developments are with weight loss for people who suffer serious health implications from being overweight. Tell us about that.
Okay, well, at Shannon, we perform the sleeve gastrectomy along with Dr. Jastro, and I help do the preoperative part, but mostly people are interested in the postoperative care, and so I wanted to talk a little bit about that today. Postoperatively, we see you pretty often to keep you on track with your weight loss goals.
As in, like, how often? So you have your surgery, which how long does the procedure take?
It only takes us about 45 minutes to do the procedure, yeah, and then we do send you home that same day in most cases, so people are on their own.
Hospital, okay.
Yeah. So they'll start on a clear liquid diet for 2 days, then advance to a full liquid diet through day about 14. And I see them about 10 to 14 days after surgery.
So normally about 2 weeks after the procedure, like any other surgery.
Yes, and then we start kind of progressing their diet slowly back to a regular diet and just kind of monitoring their symptoms. There can be some nausea, some fatigue, or the big two, sometimes some dehydration if we can't get that fluid intake up quickly.
Do you have to watch your diet after you have that procedure? Do you have to kind of keep certain things out of your diet for the future?
Yes, so we still practice healthy lifestyle, high protein, low carb diet, lots of water, exercise, eating slowly, some of the mainstays. But sugar is a big one. Sugar and carbonation are some things that you want to avoid after you've had sleeve gastrectomy.
Why is that?
Well, the sugar, the body just isn't absorbing it as well anymore, and close to 6 grams will cause some digestive issues for you. And the carbonation just pushes on that stomach that's already been narrowed down, and so there's going to be discomfort, and then it'll also stretch it out quicker, so you may not have the full results. Is this
a fairly common procedure these days?
Yes, it is. So Dr. Jastro and I have been doing it for 7 years now, and we've done over 750 sleeve gastrectomies here in the San Angelo area.
Who might be a good patient for that procedure?
So we're looking for any patients with BMI greater than 35. When it's 35 to 40, they do need a medical condition, but if it's greater than 40, they don't need any other reason to have the surgery.
And then what do you do? Kind of what are some of the first steps that you take?
So you come in and see me, and I have a class, and we kind of go over everything about it to make sure it's something you're interested in. You do see a dietitian, a psychologist, our GI doctors, and then we just follow you really close to make sure you're a candidate.
Tell us about the psychology part of it.
So she really evaluates you to make sure that if eating is one of your coping mechanisms for stress or anxiety, that you learn some other coping mechanisms before you pursue this surgery.
Which is very important. That's part of it. So the whole idea is to make your stomach smaller. So it takes less food to make you feel full, correct?
Right, yeah. So you eat less food, your body's going to stop storing fat and start burning the fat that you have for energy. There's another component where the outer portion of your stomach has receptors that produce a gut hormone called ghrelin, and it contributes to your hunger, drive, and craving. So when we remove that portion, you're less hungry, your cravings are down, and you eat less food.
All right, if someone is interested in finding out about whether they qualify insurance-wise or just interested, what's the best thing for them to do?
They can just call our office, 481-2344, and we're also on the Shannon website.
Okay, Toya Hopper with the Shannon Weight Loss Center. Nice. Thank you for being here today.